Welcome to Focus on Health. My name is Boari Michelle. Cancer is one of the leading causes of deaths in the world, and October being the Breast Cancer Awareness Month, we're going to be taking you through a cancer series, starting with the cancer overview today on Focus on Health. But even before we see Daktari, let us check out the feature of the day. That was the very informative feature of the day, and our topic today is cancer here at the HCG CCK Cancer Centre. But before we see Daktari on the topic, let us hear from the CEO, HCG CCK Cancer Centre, on what exactly the centre entails. Thank you very much, Daktari, for joining us. It's a pleasure. So Daktari, tell us about the centre. What exactly does it entail?
Hi everyone, my name is Navnit Singh Arora. I am the CEO for the HCG CCK Cancer Centre. And HCG stands for Healthcare Global. We acquired this facility in the year of 2017, and earlier it was known as Cancer Care Kenya Limited. And with HCG taking over, we renamed the center to HCG CCK Cancer Centre. Briefly about HCG. So HCG is one of the largest oncology providers in Asia today, having 27 facilities. And out of these 27 facilities, 4 facilities are Center of Excellence, and we have over a team of 400 oncologists working for us at the center at the moment. Looking at that entire expertise, HCG decided to enter Kenya in the year 2017, as we were getting quite a few patients from the East African region. And this was the first investment by an Indian hospital done in the country. Going forward, as we acquired the Cancer Care Kenya unit here, we currently are treating patients for radiation and chemotherapy. And in radiation services, we are doing 3D based conformal radiotherapy, we are doing intensity modulated radiotherapy, we are doing brachytherapy for radiation. And as far as chemo is concerned, where deliverance of medical drugs is given to the patients, you probably have seen, I've gone around the center and you must have seen the suite, the chemo suite. Besides this, we are coming up with another chemo suite for deliverance of chemotherapy at the UAP Towers in Upper Hill. and that place should be operational hopefully by mid-November. That's what we're looking at. Recently we tied up with PCEA Tumutumu Hospital in Karatina. We've signed an MOU to provide oncology services, and our doctor is going to visit, our oncologist is going to visit there once a week. We've also tied up with Tenvek Hospital, Tenvek Mission Hospital in Bomet, where again one of our doctors is going to visit once a week to deliver and take care of patients at these two locations. Besides this, our future plans involve, we want to bring a new linear accelerator in the country, which is very unique in fact to the entire of Africa. This linear accelerator will not only treat what we are doing as of now, which is 3D or IMRT based treatment, but will go a step beyond, the radiation therapy which is being delivered in Africa. So this will be capable of delivering stereotactic radiosurgery, stereotactic body radiotherapy, VMAT form of treatments, including IGRT, IMRT and 3D based treatments to the patients. Once we get there, this is going to be absolutely a unique machine for treatment for which currently patients are traveling overseas. And all those treatments will happen within the country. Secondly, we also have plans to set up a PET scan, which is the gold standards for diagnosing of cancer. But we don't only want to use it for diagnosing cancer, but we also want to use it for planning of treatment. And with the backing of HCG that we have out of India and the 400 oncologists, I think very soon you will see these technologies deployed at this center here. Another thing is that we pride ourselves in is, is something called a multidisciplinary approach to treatment for cancer. Every Wednesday we have a tumor board wherein complex cases for all patients are discussed amongst the multidisciplinary team, which includes surgeons, it includes radiologists, it includes urologists, it includes general surgeons, onco-surgeons. It also includes quite a few members of our clinical team out of India, and a healthy discussion is ensuring the best treatment is given to the patient. And as I speak, I proudly say that at this center we've treated over close to about 20,000 patients since it opened doors in 2010. Annually, we are treating close to about 15 to 1600 patients annually. So that's what we have treated so far, and also we have plans to bring in something called treatment for blood disorders, which includes treatment for leukemia and lymphoma kind of cancers. But that should happen in the near future.
What kind of supportive structures do you have in the center?
So as a unique feature, what we have is we have Faraja, which is an NGO working very closely with cancer patients, and they provide a lot of complementary therapies to the patients. For example, they do a lot of yoga, a lot of dance sessions, a lot of painting sessions, a lot of artwork for patients to keep themselves occupied. And that's not all. They in fact go to the extent of even providing financial support to the patient for receiving treatment.
And what other treatment techniques do you offer apart from the ones you've mentioned?
Currently we're just offering radiation and chemotherapy. And the future plans involve, obviously we want to go into stereotactic body radiotherapy, stereotactic radiosurgery, and treatment of blood disorders.
Apart from Faraja, have you partnered up with other organizations?
As of now, we have been working closely with the Safaricom Foundation and also with the First Ladies Beyond Cancer. And we've been receiving some very good support from these organizations to support our patients.
Thank you very much. I think it was quite something and it's really informative. I wish that everyone could actually get treated here. We are going to take a slight commercial break, and when we come back, we're going to be seeing a doctor who's going to be giving us an overview about cancer. Do not touch that dial. I will leave you with the Did You Know segment.